information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to an episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living with a mission of empowering, informing, motivating Bermuda's residents. I'm your host, Simone Hollis, public health nutritionist, and our guest this episode is Keeona Belboda. Today we want to talk about outer abuse and what you should know. I'll let Keeona Belboda introduce herself and have a discussion about her services from Aging and Disability Services.
Yes, good day. My name is Keeona Belboda, Manager and Senior Abuse Registrar of Aging and Disability Services within the Ministry of Youth, Social Development and Seniors, where our Minister is Tanae Furbett and our Permanent Secretary is Valerie Robinson-James. Aging and Disability Services, we offer a myriad of services. Our mission is to support and protect seniors and persons with disabilities at risk of abuse or self-neglect via compliance, program delivery, education, and stakeholder collaboration. Within our services, I also have oversight of the K. Margaret Carter Center, which is a day program for persons 18 plus, persons with disabilities, that are age 18 plus, and they engage in a variety of services, programs at the facility on a day-to-day basis, and this is the only free government service available to persons with disabilities.
Oh, wow. So you actually deal with a lot of ages. I was just thinking about those persons who are 60 and above, so you deal with a lot more when it comes to the K. Margaret, say it again?
K. Margaret Carter Center, KMCC for short.
Okay, yes. So, you're dealing with that because it has to do with the disabilities. Our focus today was looking at the outer abuse and what that looks like. Can you tell our listeners more about what outer abuse is?
So our remit within Aging and Disability Services, in terms of the demographic we serve, is seniors ages 65 plus. So I just wanted to make that point clear.
Yes, I said 60.
Yes. So ideally, persons aged under 65 are sought. They seek assistance from Department of Health community social workers.
Oh, okay, yes.
So there are times where they will refer up to us, or we will refer down to them, depending on what the case is and the complexities of that case, of those cases. So outer abuse is neglect of a senior in any action or inaction by any person that causes harm to a senior. So we're talking about persons that particularly are in positions of trust,
yes,
where we're expecting them to do right by seniors, to be able to ensure that they're getting their meals, they're getting their medication, they're going to their doctor's appointments. Sometimes the opposite happens, where they're left on their own, they're not getting the level of support and services that they require. Families sometimes turn their backs on them. We have some great families out there, and we have some not so great families in terms of the support that they provide to their senior loved ones.
Can you actually define some of the outer abuse that is seen? And I only say that because when we think about abuse, people are only thinking about whether the outer is being actually physically harmed, as opposed to looking at all of the other things that can be classified as outer abuse and what people need to know about. So what does that look like? What are the things that you would categorize as outer
So I'll
abuse?
ask you, so when it comes to senior abuse, what's the first thing that comes to your mind? And I will say there are 6 forms of senior abuse. So let me see if you can guess.
There's financial.
Yeah.
A lot of them get caught in the new phishing. Things like that, over the phone,
Yes.
over the internet, because they're just getting used to doing those things.
Yeah.
Well, I think that can happen to anyone, but they're more likely to do that. I've heard on the news they've talked about people coming to the home saying they're going to do work, and then they actually exploit them and take away their funds.
Correct.
Sexual abuse.
Yeah.
Seniors also deal with sexual abuse.
Absolutely.
Emotional abuse. I think that's the one that's missed across the board. For any relationship. People miss that emotional abuse is one of those things that leaves significant scars that you don't see. What else could I think about? Abandon them, not taking care of them, like I think you said, not giving them medication, know that they need help and assistance, ignoring them all day because you're working all day, knowing that you need to seek services and you fail to do so, I guess.
Yeah.
Any
There-
other ones I'm
There's
missing?
also physical abuse.
Well, yes.
There's forms of physical abuse. You see persons that are they're bruised. There's bruising on their bodies. They may have broken limbs. They may have resulted from a fall. There's a number of things that we can see in terms of the signs that we can see when it comes to physical abuse. But there are two more that people often leave off. One is neglect.
Yes.
And that's when persons in positions of trust neglect their loved ones. And one that is more widely known in other jurisdictions today is self-neglect. We have a lot of seniors that are self-neglecting in terms of not doing what they know is in their best interests. So particularly seniors that have their cognition, they have their full capacity, they may often refuse to go to the doctor. They may not take their medication. They may be diabetic and eat the wrong things, which causes other issues and other comorbidities. So those are the 6 areas of abuse: financial, physical, sexual, emotional or psychological, neglect, and self-neglect.
The self-neglect is one I wouldn't have thought of. So I think that's a really good one to give people an idea to think about self-neglect, because we think when they have their own cognition and they want to maintain their independence, that's a difficult one to work around. But can you explain, what are the risk factors for actually being a victim of abuse? Who's most vulnerable?
So the ones that are most vulnerable are the ones that are socially isolated. So those persons that live alone, they may have little to no family support. They may have not many people that come and check on them. So we always encourage persons to ensure that they keep their social networks active. There may be neighbors, even if the senior doesn't mobilize much in their home all the time. Sometimes we have neighbors that look out for them. And if they see that something is off or they're not adhering to their patterns, they may contact our office or contact the police or another family member just to ensure that someone can lay eyes on the senior to ensure that they are well. But definitely in terms of those risk factors, the highest risk factor are for those persons that are socially isolated.
Oh, wow. Yeah, I can see that. Yeah. It would be nice even if there was a buddy system. Some of them don't even have any relatives and things like that. And we all get busy about our day and those different types of things. If there was something where, people could just check on each other. We have to check on each other.
Absolutely.
All the time.
That would be very helpful. And particularly when we think about, Bermuda, and we're prone to hurricanes and the like.
Yes.
So when we're talking about that inclement weather that's coming, we want to make sure that we're checking on our loved ones, checking on persons in the community to ensure that they are well, to ensure that they have, the water and things that they may need during that time, and to check on them after the hurricane to ensure that, all is well and that they boarded well over that time. But yeah, within our office, we see a myriad of issues or dynamics in terms of all levels of abuse. And sadly, what we are seeing largely is that families are the greatest abusers.
Oh, no.
So we think as Bermuda, being a close-knit community, everyone helping everyone, but certainly we see the other side of that in terms of persons that just don't act in the best interest of their loved one. Whether it be financial exploitation, we also encourage persons not to add just anyone to their bank accounts, for example, because the police have a very difficult time navigating those cases. Because if a person is being financially abused and they're utilizing that account, the police determine them as having just as much access to that account as the senior. So they're able to spend those funds because they're a joint account holder. So we ask persons to be very, very diligent in terms of who they select to be on their accounts, and to ensure that as a person that's in a position of trust. We would love to think that our families do the right by us, do the best thing for us, but that's not always the case. So again, we want to make sure that it's someone that's in a position of trust that you're adding to your accounts.
Yeah. But one of those things we talked about, those seniors who have their cognitive abilities of where they can think for themselves, do for themselves, and those different types of things. What about those ones who can't? I mean, there's something about the power of attorney. Are you able to assist with that in the correct direction, or provide them with help and assistance of what that looks like, especially if people have those questions?
Yeah, so we give guidance in terms of power of attorneys. That's not something that we do specifically within the office, but we do give recommendations in terms of the levels of power of attorney that they can access. So two of the main ones is an enduring power of attorney, and an enduring power of attorney is for persons that have their cognition initially, and they may become incapacitated along the way. And that person that's their enduring power of attorney, they can continue to provide financial support. They can continue to assist with their property matters, help make their healthcare decisions. That's why it's termed enduring, because it continues. Then we have regular power of attorney, and that's for a person that has their cognition, and they're able to determine who they want to be their power of attorney, and they select that individual. However, when they lose their capacity, the power of attorney stops. So enduring carries on even when a person becomes incapacitated. If it's a regular power of attorney, when a person becomes incapacitated, it stops, it ceases.
Okay.
Because one will require a cognitive assessment to speak to their cognition. So even when persons are engaging in obtaining power of attorneys documents, they should still be seeking to get cognitive assessments on the seniors to ensure they have capacity to make relevant decisions for themselves.
Oh, wow. A lot of information you're actually providing me with here. So a lot to think about. Especially as we all age, what do we want to do in moving forward? I mean, that's something that everybody should be doing, wills and power of attorney for. Absolutely. A lot of those things.
It's planning for the future.
Absolutely. So you talked about a lot of the abuse is occurring from family members. What about with caregivers? Like, what does that look like? Because I know you also have like a registry as well, a outer abuse registry, it's called.
So it's a caregiver registry.
Okay.
That was a registry that did sit within Aging and Disability Services. It has since which been transferred to Bermuda Health Council, so they have oversight of that registry.
Okay.
But persons have been in positions of abuse when they have been in care with their caregivers. So caregivers, again, we're talking about persons that are in persons' homes, because that's the intent of the caregivers, is to maintain persons at home so they can age at home. So caregivers are going into one's home to provide care, and as you can imagine, if one is incapacitated, loved ones may not exactly know what's going on. So we ask persons that when they're selecting caregivers, just how you would go around when you're having children and make sure that you check to ensure that the nurseries are at the quality or standard that you would want to ensure that your child is in a caring and safe environment. The same applies to the senior.
Yeah.
You want to ensure that you're asking the caregiver questions that are relevant to what you feel that your loved one needs. Are they CPR trained? If an emergency was to arise, how would they deal with it? Do they have transportation? Are they able to take their loved ones to their appointments? So those are the things so you essentially want to interview the caregivers to ensure that they're acting in their best interest. But again, sadly, not all caregivers do, but we do also have some really great ones out there.
Right, but they do have that registry that they can look to see whether these are persons that are not going to be suitable as well.
They do.
So that would be the first part of elimination.
Yes.
Of finding out who actually may have, applied for a position to help and assist you.
Absolutely.
And it's really needed.
Absolutely. And when we receive concerns about caregivers, we will depending on what it is, we will go out to investigate if we receive a report or referral of abuse. So certainly in terms of reporting concerns, we ask people in the community, if you see something, say something.
But can I say, is that part of your complaint process? Like, you actually have to, I think one thing Bermudians don't understand is that you can't just tell someone. It has to be written as a formal complaint process to be addressed.
Yeah.
And that's where you're most likely going to address those than just like, oh, well, I'm just coming by to tell you need to check on ABC, and I saw that this person was abusing somebody, and,
Yeah.
it has to be written.
Absolutely.
Is that correct?
So yes, so we do have a referral and intake process. We receive referrals from persons in the community, doctors, from the hospital, from family members. So there's a myriad of ways that persons can refer to our office. They can do it over the phone, they can come in person, they can do walk-in. Our walk-in hours, as a disclaimer, is from 10 to 2 p.m.
Okay.
Monday to Friday.
Okay.
But persons, certainly, we will take their information and record it and enter it into our case management system. Once the referral is entered into our system, it will be assigned to a social worker
Okay.
to be able to take on the case and navigate the concerns of that case.
And following it through, that they would get a result.
And
rather
following
than-
through. And I will say that oftentimes when we receive referrals, it will come in an urgent nature. But
Yes.
once we really dive in and delve into what is going on, it's not so urgent. They may need some support, but we assist them with navigate the case and their concerns as best as possible. So we offer case management services, and sometimes we just provide general information to persons. They just want to know. They're not always sure of how to connect to various resources within the community.
Yeah.
So we assist with connecting them to resources in the community. Some may require assistance with making application to financial assistance.
Yes.
We will help with that process. They may just need to know where to go for certain things, so we would provide that navigational support in terms of how to access the relevant services within the community.
Yeah, this is a lot. I mean, as we talk about Bermuda and aging population, I remember when I first started working, we were having like 1,000 births, or even more than that. I mean, it's going down to maybe 400 or maybe a little bit less than that.
Yes.
So I can only imagine with an aging population how much assistance a lot of them do need, and especially with as they're aging, things change. Your body changes.
Yeah.
So I can only imagine.
Yeah.
But do you have some statistics about the elder abuse in Bermuda? Just some basic guidelines. I know we talked about the specific types. You talked about which one was, the most that you see. But do you have any statistics that we can?
Yeah, so
look
these
at?
are statistics that we presented during our budget brief. So during fiscal year 2022-23, ADS, short for Aging and Disability Services, opened 287 new cases, and that's an increase of 10% from the previous year. As you can appreciate, there's a declining birth rate, but the seniors are increasing. So we recognize that by 2026, they would take up approximately quarter of the population will be seniors. So we have to be able to be equipped to be able to service these individuals. So in terms of the cases that we received, 30 case management referrals were received for persons under 65 years of age. So we also provide services to persons with disabilities ages 18 plus. So that's the referrals that we've received, 8 of which of those included reports of abuse. We also received 165 case management referrals for persons over 65 years of age, and 89 reports of those were alleged to be senior abuse cases, of which, in terms of the breakdown, 35% were for financial exploitation. As you can appreciate, that is the biggest area of abuse and the largest area of concern. 25% were for physical abuse, 24% for psychological abuse, 12% for neglect, and 5% was for sexual abuse.
Oh, wow.
So that puts a lot of weight on our office. We're a very small office. We're 9 strong. But even with us being 9 persons, we only have 4 social workers. So we're talking about 4 social workers going out to service persons in the community, which gives us a social worker, to client ratio of 1 to 52.
Wow.
The
That's a big caseload
it's
to try to
absolutely-
manage when you look at the complexities and all the dynamics that occur and the assistance, what they need, and make sure you can actually close a case. I
Yeah.
mean, that's a lot.
Absolutely. And particularly when best practice speaks to those case loads being 1 to 25. So we recognize that the office requires staffing up. We have undergone a management services review. We have been able to onboard 2 additional social workers. We're soon to be onboarding a policy analyst, which has been long awaited.
Yes.
So we're excited about that. But we certainly need to ensure that we equip our office to be able to deal with the competing demands of helping to eliminate or reduce risk for seniors and persons with disabilities in our community.
That's excellent. You provided so much information, but as we begin to wrap up, I just want to ask you about there's Elder Abuse Awareness Day on June 15th. Does ADS have anything planned?
So last year we had our first annual seniors tea, which was undergirded by elder abuse. So we had different presenters that came to speak on elder abuse and how to navigate such, and to provide tips on how to equip oneself to protect themselves from abuse. This year we're hosting our second seniors tea, which is going to be before June 15th, World Elder Abuse Day, which will be a precursor. And again, we will be providing information on elder abuse at that seniors tea. So that's kind of our engagement that we're going to have this year. That will be in alignment with World Elder Abuse Day.
Okay, thank you. So is there anything else that you would like to add before we actually close the podcast?
Yeah, so also within our office as Senior Abuse Registrar, I maintain the Senior Abuse Register.
Okay.
And that is for convicted persons that are convicted of senior abuse. And the magistrate will determine whether one should go in the register or not. So the court provides that information to our office in terms of the victim, their sentence, what the abuse allegation was, and the person's name gets, and I add the person's name to the register. We haven't had anyone entered on the register since 2022.
Okay.
I want to say. Okay. So again, we feel that it is our duty to be able to provide tips and to ensure that we can equip and arm our senior community and their loved ones for identifying the signs of abuse to ensure that they know how to safeguard themselves. So in terms of the 4 tips, we want to make sure that persons know the signs of abuse, persons changing patterns, persons are having bruises, they're emotionally withdrawn. Those are some of the signs that one will look for, and to know how to report. So if a concern comes up, they can report it to Aging and Disability Services.
Is that anonymous?
Yes, we have a duty under our Senior Abuse Register Act 2008 to keep our reporters confidential,
okay.
Their information confidential. We do not have an obligation to state who the reporter is. So we always tell our clients that, because some do report with a concern, knowing that if they say something that, depending on the information, persons can identify who the reporter was. So persons can report anonymously. They can contact Aging and Disability Services on 292-7802, or they can email ads@gov.bm. And we're located in the Continental Building on 25 Church Street in Hamilton.
Well, thank you, Keeona, for joining us and helping us to go through and navigate through the elder abuse, what that looks like, the assistance we can get, how we can help our seniors and make sure that, that they actually can be assisted a lot better through your services.
Absolutely.
Thank you, listeners, for listening to the Health-Abets podcast. So where we discuss everything from A to Z on healthy living. And I hope that you will tune in to our next podcast. Follow us on Facebook, the Department of Health Facebook page for the next episode. Thank you so much.
You have been listening to Bermuda Health-Abets, Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.